Hi, I'm Mark Wow, and I'm explaining how to do an enema. So here is an enema bag. There are many different kinds of enema bags out there. You usually find the easiest ones to find are going to be the pink ones that look like a hot water bottle, and they're going to have an enema douche attachment, and the attachments are very different. So the enema attachment is going to be a single small white tube, and the most important thing is when you're thinking about doing this, do not ever start to get scared thinking that that tube will end up hurting your colon, because the tube is very small and it's not going to perforate anything. However, if you're having any kind of rectal bleeding, hemorrhoids, obviously those things you really want to get some help before you go ahead and do an enema. So the important thing when you're doing an enema is people are always thinking, well, what about doing a coffee enema, a wheatgrass enema? Start out with doing a water enema. It's probably the best way to do it. Make sure that the water, I like to use filtered water, but you can use any water. Given that you've been drinking tap water and you've been taking showers and baths in tap water, your body is used to tap water. It's not going to poison you. However, I would use filtered water. That's what I recommend. The other thing is when you're using the water, it's really helpful that you keep it comfortably warm for you. So part of the mechanics of an enema is that you will tend to get a little chilly. So I always tell people when they're going to do an enema, make sure that the house or the bathroom that they're using is warm. Make sure that they wear probably a t-shirt and maybe a sweatshirt on top and socks, because even though you're using warm water, sometimes it's very easy that you'll feel cold, especially if you're going through getting out something that's really toxic. Sometimes you can feel very cold as that stuff's coming out. So make sure you're warm throughout the entire time. And if you need to, you may need some hot drinks there so that you can stay warm from the inside out. Now, most people when they're doing an enema will find that if their bathroom is big enough, they'll put down some large beach towels in the bathroom so they can lay down in the bathroom, but some people's bathrooms are not big enough, so they have to do it outside the door, outside their bathroom. So you figure out where you want to do it and make sure that you have a comfortable place to lay. You know, you might, if you have a tile bathroom, it's probably good to put down either a yoga mat or some kind of pad and then some kind of beach towels on top of it so that you're comfortable, because you're going to be getting up and down, and if it's at all uncomfortable for you, you're going to probably want to quit early. So it'd be better to make it comfortable. The other piece about doing an enema that I like is that I want to be as relaxed as possible, because for me, it's about allowing my body to maintain peristalsis. And so if you're tense or anyone's tense during it, it's going to be harder to eliminate. So if you like to have music on in the background, anything that will allow you to relax, please do that. I generally don't recommend candles, because sometimes people will be moving around the bathroom, and if you knock something over, you're not going to like it if you end up having to clean up a mess and you have to start a fire. So do whatever keeps you relaxed and comfortable in that environment. So you've used warm water. The water has to be warm enough that when you touch it with your finger, you feel a little warmth, not hot. You can put the warm water in the enema bag, in the top of the enema bag, and then you're going to lubricate the tip. And the most important thing is that I almost always recommend, you can go buy lubricants, but I recommend using some kind of vegetable oil. Castor oil is my favorite because it's thick enough, viscous enough, so that it will stay on the end of the enema tube and it will not disappear very quickly. Yes, people use KY jelly and they use a number of other things, but I'm going to recommend a vegetable oil. Almond oil sometimes works and it's easy to get. But the reason I'm recommending this is because it's going in your body. You're not going to eat KY jelly, you're not going to eat petroleum jelly. So if it's going in your body, you're getting some absorption through the GI tract. That's why I'm recommending vegetable oil. So you're going to lubricate the end of the tip, and you can find that when you lubricate it enough and you also lubricate your anus, you can get it in without any pain or any discomfort. And if you look at the end of this tip, there's no way that's going to do any harm to you. Again, if you have had hemorrhoids, any kind of rectal bleeding, that's probably going to be a contraindication. So when you insert this in the rectum, you're going to find, now the most important thing is that you're comfortable with it. So you're going to probably find that it'll be a little uncomfortable when it goes in, but once it's in there, it will feel okay. The other thing I would like to recommend is that while I'm doing enemas, I want to control the flow of the water going in, because the kind of discomfort that comes from doing enema is when the water goes in too fast, you'll feel some cramping or spasming or pressure or pain or discomfort. So the most important thing is you're going to have some kind of diverter switch that's going to cut off the flow of water. And a lot of people recommend hanging their enema bag from a hook above them. I find that if you do that, the higher up the enema bag is, the more force you have of the water going in. So I recommend to most people that when you're lying on the floor and you're doing your enema, that you just lift the bag a little bit above you, because the higher you lift it, the more force you get. So if you lift it and you put it down, that way if the water feels like it's coming in a little fast and you haven't had a chance to divert it, to cut it off with the diverter valve, then you can actually slow down the inflow by just keeping gravity as your assistant in doing that. But if you do want to hang it, remember that you're going to have your finger on this particular thing back here, so it's going to be back by your rectum, and you're going to have to be ready to cut it off, because when it feels like the water is going in too fast, it may even fill up so fast that it actually pushes the tube out, or you start to get some discomfort. So the goal is to not try and take in all the water at once. You take in water until you start to experience discomfort where you feel like you need to expel. And that's going to vary a lot based on what your history is, what you're bringing to it. Now when you want to expel and you want to take the tube out, or if you need to stop the flow of the water, you use the diverter switch to cut off the flow of water, and then you're going to pull the tube out of your rectum, and then you can get up on the toilet. So the thing for most people, if you wait too long and it feels like this is pushing out, then you might find that you can't control it very easily, because if you have a lot of fecal matter backed up, sometimes that will start to push out. So you really want to take in water, especially in the beginning, a little bit at a time till you feel some discomfort, and then you want to either pause, breathe a little, or cut it off and then get up and expel. Now if you've had a history of chronic constipation, some of what's going to happen when you put water in is you may not feel like you can take hardly any water in at all. You may take in just a few ounces, because if you have fecal matter hanging out at the end of your rectum, you won't have a lot of room for water. So you take in a little bit of water and it feels crampy, spasmy, uncomfortable, difficult in any way. You're going to get up and you're going to take the tube out, of course, and then you're going to expel. You might find that you have to massage your intestines a little bit to try and get it to release. And it's important that you be patient with yourself so that it'll come out. Because if you've had chronic constipation and the fecal matter is relatively hard, you'll find that it doesn't want to come out very easily. Likewise, when you have diarrhea, sometimes the intestine feels like it's a little spasm closed, and so the water doesn't go in as easily, and so you have to let it in slowly. After a while, when you've gotten practiced at it, you'll understand what it's like to let water in at the rate that your body can let it in. So the goal is not taking in the whole bag. The goal is not that if you do that in any way, you're better than anyone that can only take in little. You may be doing multiple fills and flushes. If this is your first enema, maybe you're only going to do 1 or 2 fills and flushes. And a fill is not the whole intestine. A fill is letting water in till that pressure or discomfort occurs that you feel like you need to expel. So you will figure out over time how many you need to do. One of the things that I explain to patients is after you've done enemas a few times, then you can start to figure out how much room you have, how much capacity you have for taking water in before you have to expel. It can change. So based on whatever conditions you've had, let's say the enema you did the last time, you were able to, after 3 or 4 fills and flushes, you were able to take in almost the whole bag of water. You might find you haven't done one for 2, 3, 4 months, and you go to put water in, and it's like, I feel like I have no capacity. Has something bad happened to my intestine? No. You just have some fecal matter that's backed up or some little imbalance in your intestine, so that you're going to have to consider yourself sort of starting over again and being willing to let the water in again. It's rate dependent on your ability to hold the water. So since we're doing enemas, you need to think about the best way to make this work for you. And I'm generally going to recommend you can lie on your back. If you have problems for any reason lying on either side, clearly lying on your back is acceptable. Generally, you do better if you can lie on your left side. So you might want to have made sure that you put a towel down and a mat down on the floor so that if you're uncomfortable, then you're going to feel like there's some padding underneath you. So you're lying on your left side, have a little pillow or something to support your head so it's not hanging in outer space. So you're lying on your left side. Why? Because the intestine is, we have an ascending colon on the right, we have a transverse coming across the middle, we have descending on the left. If for some reason you're lying on your back and the water doesn't feel like it wants to go in very easily, you're probably better off to lie on your left side, because water will go basically somewhat downhill and it's easier for water to follow gravity. So if you find yourself filling and flushing lying on your left side and you're getting a little bit of water in and then you have to get up and expel, after 3 or 4 inflows of water, you might find that you can take in a lot more water on that left side. And if you can, then you can, after you've done that successfully, you might roll to your back, lay on your back, and now you can help massage your intestine a little bit from going up the left side and a little across the right. So now you can move the water into the transverse colon. Remember that always, if you can do this, if you can hold on, it's always better when you finish. So let's say you've been on the left side, you've taken some water in, you've done a few fills and flushes, and now you've moved it, you're lying on your back. Always move back to your left side so that the water can come across, because you don't want to just get up from lying on your back and some of the water may fall down or hang in the intestine. And so you sit on the toilet and you feel like nothing is coming out. If you're able to, right before you're going to eliminate, lie on your left side and do a little self-massage to move it from your right side towards your left and down, you'll find that the water will eliminate easier and you might not feel like you're trying to sit there and wait for a long time. Occasionally, when people are waiting too long and they feel like the water's hanging up in there, I'll recommend that they put their fingers just gently into their intestine and they try a little bit of a lift, maybe go towards your head, go a little bit towards the right, go a little bit towards the left, and you'll find that there'll be some direction that you're going to go, and you're going to be pushing in a little bit, and you feel like things gurgle through or move through much easier. So if you've sat there for a few minutes and nothing's coming out, try palpating, pushing in on your intestine, move a couple directions, and you'll feel one direction that seems to release that, and then you might be able to eliminate a lot more.